Good evening all. Welcome to today's Cancer Healing Journey Talks. Myself, Annie Jose from Community Outreach Team of ZenOnco.io and Loveliest Cancer. Cancer Healing Journey Talks helps cancer survivors and caregivers to share their journey with vast number of survivors and caregivers who have traveled or been traveling through this journey. This can inspire and motivate them for their faster recovery as well. Firstly, I would like to introduce today's speaker, Katherine Marie. Welcome, Katherine. She is a cancer survivor.
Thank you so much.
You're welcome. So she's a cancer survivor. She's also a speaker and a holistic health coach at Inspired Vitality LLC. She partners with clients as they identify their health goals, strategize, and guide them throughout their process of achieving these goals. She believes optimal health takes consideration in all areas of one's life, which includes physical health, relationships, spirituality, physical fitness, joy, and nutrition. She also provides complimentary health consultation to anyone who is ready to make changes as well. So welcome, Katherine, once again to the session. So I'm handing over the session to you. You can start with your journey.
Thank you so much. I'm so happy to be here. And please, if at any point you want to stop me and ask me questions, just do that, please.
Sure.
Yes, my name is Katherine. I'm in the United States. And it was in 2015 when I was suddenly diagnosed with stage 3 breast cancer. I had just gone for a regular checkup with my doctor and she and at that point she sent me for further testing. And for me, that meant a diagnostic mammogram and an ultrasound. I went to that a few days later. And when I went to that appointment, I found that the radiologist, when she was doing the ultrasound, didn't want to look at me. And she had the doctor come in after the test, the radiologist. And at that point, he said there was an area of concern in my breast and in the lymph nodes under my arm. Excuse me. And so he suggested that I have a biopsy. So I had that biopsy the following week. And when that radiologist told me that I had the concern after the ultrasound, I knew at that point that it was really serious and I was really concerned. I saw a look on his face that showed me that this was very, very concerning. And so when I went for the biopsy, that doctor was more forthcoming. And she told me that the tissue did not look like normal breast tissue. She said that that I would get the results in 1 to 3 days. But it was the very next day that a nurse called me, and it was a stranger I didn't know. And she just called me up and she said, I think you know that you have breast cancer. So that began the process of setting up appointments. And I saw an oncologist and a surgeon and had further testing to make sure there was no other cancer in my body. And then it was exactly 3 weeks after my diagnosis that I was in surgery and I had a double mastectomy. And I chose to do delayed reconstruction. So at that time, they were just removing the breast tissue. And after I healed, this is just kind of a general timeline, but after I healed from that, I then had chemotherapy, and that was 5 months of chemotherapy. And after I healed from that, I had 6 weeks of radiation. And of course, that was really, really hard physically and emotionally. And I then began my reconstruction process in June of 2016. So it was over a year after my excuse me, it's really early in the morning here, but after my diagnosis is when I actually began the reconstruction. And for me, I found that it was after the active treatment that I was looking around going, holy cow, what just happened? You know, it was like I just functioned through the initial treatment. And it was really, really hard afterwards. When I began rebuilding my body physically, I felt stuck emotionally. And I was really, really scared of the recurrence of breast cancer because it has such a high recurrence. And some of the side effects that I was dealing with, I experienced neuropathy or nerve damage in my feet and had a hard time walking. And I've since then discovered that acupuncture is very, very beneficial for helping me with my neuropathy pain. But when I was going through that reconstruction process, and I was really scared and stuck in that recurrence, one day I read something by another cancer patient that felt to me like it was a rope being tossed to me. And what she said is, I don't want to look back decades from now and realized I'd lived my entire life in fear. And so that for me was kind of a wake-up call of I needed to live my life now. I needed to move forward, and I needed to start really enjoying and living life and not just being stuck in fear and getting through each day. So it was at that point that I started doing things for my own health and studying ways that I could move forward and be healthier. And so although I was still going through ongoing treatment, and some of those after active treatment protocols, medications, they can cause you to lose your hair, they can cause you to gain weight and all of these things. And then the chemo brain continues. And I think for me, the best thing that I can do is incorporate joy. And that helps me get through some of the yuck that still continues to this day. And it's really important to me to be a voice for the cancer patient in helping people that don't have cancer understand that treatment doesn't end with active treatment, and that there's perhaps ongoing medications that cause side effects, and that the effects of the initial treatment can be lifelong, and that patients still struggle years and years later. And I'm still really, really grateful that 6.5 years out, I am no evidence of disease. And that, it's just really important that we go forward and live with joy, because I believe that you can have cancer and, using my and sign back here, you can go forward and have cancer and you can have joy.
So who was your support system throughout your journey?
My support system, I have a few family members nearby who helped me with rides during surgeries and helped out physically when they could. I had great coworkers that provided meals when I needed them. So I don't have a lot of people surrounding me. I don't have a huge support system. I had friends and family pitching in when they could. And I think that's why what I resonated with, I loved some of the community message boards, and I know you guys have some support for patients as well. And I think that's really important. When I was going through the reconstruction process, I met somebody online, and her name is Rachel. And when I met her, she had stage 4 breast cancer. And that friendship was very special because it was really, really hard, because she was dying from the same disease that was in me. So it was really hard for me to bond with her, in that I was scared, because she was showing me what it was like if my cancer came back. And so, but yet I went forward and we became very, very close friends. And we would laugh and cry in the same conversation. And for her, she showed me that having that person that is outside of the family dynamics, but has an understanding of the disease is really, really helpful. And so that's what I try to be for cancer patients, is I try to be that person outside the family dynamics that knows kind of what they're going through. You know, it may not be exact, but have a similar experience. And so I think the most important thing for people to understand is that not everybody can be your complete support. You know, you might have a partner or a friend who is good at supporting you in giving meals, for example, or you might have another person that's really good at supporting you emotionally. Not everybody can be everything to you emotionally and in a support manner, and that it really does take a wide variety of people to support you in your whole experience.
Did you make any lifestyle changes during or after the treatment?
Yes, most of my changes occurred afterwards. I have to say, I like to tell people, do as I didn't do, because I wasn't very good at changing things during treatment. I remember a nurse telling me that I should get up and walk more, and I didn't. And really part of my story is that I also have 2 children, and they were almost 15 when I was diagnosed. I have twins, and they were born premature, and they both have special needs. So while I was going through cancer treatment, I was also caring for my children with special needs. And so, yeah, I'm sorry, what was your question? I lost track of what I was saying.
No, what I was asking is that did you make any lifestyle changes during or after your treatment?
Oh yeah. Sorry, I lost track. So the changes that I did do, I did try to get out and walk, but because I was also caring for my children at the same time, it was really, really hard. I mean, there were days when we got dressed and we ate, and that was a huge accomplishment. During chemotherapy, sometimes you just get through it. And it was afterwards that I began taking a look at my own health and going, okay, I really need to incorporate stress management, because I had never really done that before. I had done massage, or I had done a little bit of journaling or writing, but not to the extent that I am now. And I find so much value in stress management now. And that's been a huge change. I have completely changed the way that I eat, and I'm more of a plant-based eater now. And I just feel better eating that way for me. And, I was exercising before, but I'm more conscious of it now. And so a lot of the healthy changes I made afterwards. And cancer changes relationships. And for me, the way that changed is that I more value deep relationships. I don't prefer to just have relationships that are casual. I like those deeper relationships that give a little bit more value to my life.
So do you have any fear of recurrence?
I'm sorry, I didn't catch that.
Do you have any fear of cancer recurrence?
Of course. I think everybody who's had cancer once is going to fear the recurrence. And there's triggers for cancer patients. And I think, some cancer patients have follow-up appointments, and that can be a trigger. And it might be just a simple doctor's appointment, or it might be a scan. And right now, as during this recording, we're recording during Breast Cancer Awareness Month. And for breast cancer patients, that can be a huge trigger that causes anxiety because they see pink everywhere. At least here in the United States, there's a lot of media coverage about breast cancer awareness. And that can be a huge trigger and cause anxiety. And I have a fear of recurrence, and at the same time, I go forward living joyously. And the thing is the fear is always going to be there, but it's a matter of managing it and understanding that fear is not fact, and that fear is my emotion. It's not based in fact. I don't in fact have cancer at this moment. And so I need to manage that fear so that I can continue living and enjoying my life each day.
So, how much do you think we should provide awareness to the public out there?
I'm sorry, I didn't catch all that. How much what?
How much do you think we should provide regarding public awareness? So how much important it is?
Yeah, the public awareness, like for the awareness cancer months, that sort of thing.
Mm.
You know, I think it's important. I want to share with you what, for me, what Breast Cancer Awareness Month, or really any Cancer Awareness Month, means is that, number one, for me, it's important to communicate that people should do self-exams or get their screenings done when it's appropriate. You know, not all cancers you can't do the self-exam, or screenings, but when it's appropriate, do your self-exams, do your screenings, and really be aware of the importance of that. The second thing that I like about awareness months is to, like I said, be that liaison for people to understand that a cancer patient might be having a difficult time physically or emotionally, even years out from their diagnosis, and helping family and friends understand that. And third, I really like to honor the cancer patients that are struggling with, for example, the metastatic breast cancer patients or the people who have passed from the disease. I think it's really important during these awareness months to respect and honor the people that are struggling or the people who have died, and not just the survivors. So those are, for me, the important aspects of these awareness months, not just create these big celebrations, but to have some honor and respect around the struggles.
So one last question, Catherine. So what will be your message to the cancer survivors and caregivers out there?
I'm sorry, one more time, please.
Sorry, what will be your message to the cancer survivors and caregivers out there?
Okay, so caregivers, I'm going to break this down into two separate things. For the caregivers, my message is please ride that emotional roller coaster with your cancer patients or your loved ones. You know, it's a roller coaster that is very big, with really big highs and really big lows, and be sure to stick through them with the person through all of that, because there are some people that unfortunately walk away. And so I encourage people to, you know, just stick with their friends and families and have some understanding that it's a really hard and long road. And I encourage patients to share their feelings with their friends and the family, and just reach out. And when they're feeling low, be sure to reach out and just know that this is really hard right now, right? And it's whatever you're feeling, it's okay. And that there is love and support out there for you.
Thank you so much, Catherine, for your valuable time. I'm sure that this session will really motivate people out there who have traveled or been traveling through the cancer journey. So thank you so much. It was lovely having you here.
Thank you so much. It's an honor to talk with you today.